Thank you so much to Sages, to Dr. Ross, Dr. Polly, Dr. Wright, who couldn't be here, for the invitation to speak on this topic. I have no disclosures. Sorry, guys. There we go. All right, so social media has really just revolutionized and infiltrated our lives in so many ways, right? So it impacts how we connect with one another. It's impacted the information that we share. We can share news content. We can share a whole boatloads of information. And if we look at the trend, when social media first kind of started in 2005, really just 5% of American adults were using social media or social media platform. That's really kind of skyrocketed to the point where over 70% of American adults are using some social media platform in some way. Let's see if I can go the right way. Nope. All right, so because of how social media has really revolutionized the way that we communicate, I actually think it's a very interesting time for surgeons, right? We are all kind of learning, how we can communicate with patients. We have new opportunities to communicate with colleagues, both domestically and internationally. We have opportunities to communicate with our trainees. And most importantly, we have opportunities to communicate with our patients in ways that we've never experienced before. So I think it's an exciting time for us in our profession and as surgeons to really take advantage of these opportunities. There we go. So we'll talk briefly about how social media can be used as a tool for professional development, collaboration, education, and opportunity. I'll focus primarily on Facebook and YouTube. I'm not going to talk about some of the other platforms. I think those will be talked about in the session. So just some social media basics, which Dr. Polly actually covered nicely. So YouTube and Facebook are actually the most commonly used, with YouTube kind of edging out Facebook. But the thing about Facebook is that Facebook users are pretty loyal. So they are using this the most, right? And so they're using it greater than 70% of the time, and they're using it daily, more than multiple times a day. Facebook was started in 2004, and since it started, it's kind of skyrocketed in terms of the number of users and the amount of content that we can share. And that has good, there's good things that are, excuse me, there's good reasons for that, and there's also bad consequences of that as well. I think that we've seen in the COVID-19 pandemic, where there's been a lot of misinformation out there. That said, actually, it's pretty easy to use your smartphone to engage on these platforms. So here's an example of the Facebook forum that I'll talk about shortly. Dr. Teitelbaum, who I think is in the audience, is posting about a patient. He posted some imaging. I'm kind of scrolling through on my smartphone. I can engage with it. I actually love this post for whatever reason. And then I can comment and give my thoughts about what I think about the case. I think I just said here, thanks for sharing. But it's very easy to engage on these platforms right on your phone. In terms of YouTube, the main way that YouTube works is that it's a video sharing platform. So, but similar to Facebook, it was created in 2005, so a year after Facebook. And then again, it's kind of skyrocketed in terms of the number of people who are using YouTube, and then the number of people who are engaging on this platform. Similar to Facebook, it's very easy to engage on these platforms. So here I am going to, I think, the Sages YouTube channel, and actually kind of in reviewing for this talk, there's actually some really great content on here. There's about 50,000 subscribers. There's lots of content from past meetings, from webinars, ab site reviews for the residents. So I encourage you all, if you're interested, to spend some time. If you use these platforms, Sages is a good a good channel to subscribe to. The other thing that I really like about these platforms is that there are analytics capabilities. So you can look and see how people are actually engaging with your content. How often are they viewing your content? How often are they liking, disliking, commenting on? And so all of these platforms have these analytics capabilities. You can use this when you're thinking about developing your individual brand, but I actually really like it. As an associate program director, I run some of our social media accounts, and it's great in terms of figuring out content that some of the residency applicants are interested in, seeing what they like and what they dislike. So right now, there are many programs that have free analytics offerings, but I think that will change. There are some that actually cost. All right, so how can we actually use use social media for these purposes? So I'll talk briefly about this closed Facebook group. So in response to kind of the rise of social media, SAGES actually created this closed Facebook forum to discuss diseases of the esophagus, stomach, and small intestine. It's the SAGES Masters Foregut Collaboration. And so in this group, there are practicing surgeons, there are trainees, there's actually surgical industry as well, and then all the members of this group are actually vetted by the founding committee. And so when I was a fellow at the University of Washington, I was interested in, well, how are people actually using this forum? So we actually looked at content for about a year and categorized it. So the aim was really to describe, well, how are people using this for professional development, for education, and for quality improvement? So as you can see here, most of the members were practicing surgeons, followed by trainees. And then when we looked at the content, we broke it down into 5 categories. And most of the content that was discussed was operative strategy and patient management. There was a low risk of patient privacy violations. There was 1 post and a year worth of content that had an identifiable patient information. It was in an endoscopy report. And of course, it was deleted once the moderators were identified. So how are people actually using this as a real-time example? So a surgeon's going to post a case with a question. They're going to include some imaging studies, endoscopy and manometry. This is going to generate 17 comments in 24 hours. People are going to ask, hey, what did the swallow study show? And the surgeon's going to post the study, and you can actually see it. It's a real video. You can see the upper GI. Someone's going to post a relevant article link just to give some evidence-based medicine to help guide this conversation. And then the surgeon is going to take all that information and say, hey, thank you so much. I actually am going to alter the plan a little bit for this patient and push for another study. So that's just one example of how people can use this forum. Now that can have good and bad consequences, right? So things like opinion overload or groupthink phenomenon and the bandwagon effect can actually really permeate these groups. And so if the moderators or if you yourselves are not trying to minimize those types of things, we can let popular opinion kind of permeate the group as opposed to evidence-based medicine. So those are always things that we have to be mindful of when we're posting in these forums. And then lastly, patient privacy violations are rare, but in general, you should remember that the content is always discoverable. So even if it's in a closed group, it is discoverable. All right, but all that said, I do think that this is an example of how this platform can be used as a real-time forum for discussion, for learning, and for collaboration. And SAGES is actually, with the success of the Foregut group, has actually expanded. There's multiple specialties where you can have these discussions. I'm actually involved in the robotics collaborations as my robotics practice has grown. All right, so let's quickly move to YouTube and talk about education and opportunity. So I actually think that YouTube channels are really great for people who have an interest in medical education. This is Dr. Andrew Wright's YouTube channel. And just kind of looking at it, you can see there's just loads and loads of content, primarily skills-based, that is directed towards medical students, directed towards junior residents, and even some senior residents. And so if you have an interest in medical education, whether you're a program director or whether you just have an interest in it, you can curate a channel with content for your learners. So I actually use this in my own practice. This is actually, Dr. Wright's channel is the pre-work for some of our students as they head to Skills Lab. Kind of continuing on with education, you can actually extrapolate this to your patients, right? So you can create a YouTube channel for your patients. This is just an example that I found online where there's information posted about, there's actually a video for surgery, there's information about your pre and post-op care. And so this is a nice tool for you to be able to kind of curate the information that you want your patient to have, because they're going to be exposed to so much information. So you're not going to be able to address it all in your 15 or 30-minute visit. So this can be a nice opportunity to share and communicate with your patient afterwards. And then lastly, just as how you can use this for opportunity. So you can use your YouTube channel to promote your own personal brand. I'm using GW School of Medicine here as an example because I think they did a great job of showing, promoting research and talking to patients and then highlighting our faculty. But if you personally want to, if you're passionate about social justice or climate change, you can use these channels as a forum to put hopefully credible information, but accurate information to help amplify causes that you're interested in. And then lastly, I'm wrapping it up, some keys to success if you're ready to connect. I always tell people, just get on these platforms. I'm a big proponent of lurking first. I actually lurk a lot on Facebook. You don't have to worry about posting. Just consume the content, and then you have questions, feel free to ask. So join Facebook groups, subscribe to the YouTube channels, and if you are interested in creating a brand for your program, let's say you're a residency program director, don't reinvent the wheel. A lot of times universities and organizations have their own social media teams that, like, this is their job, so they can help you actually design and curate what you want. And so that's actually what I did when we were getting our GW Twitter and Instagram accounts ready to make sure that what we were putting out aligned with the brand of the surgery department and also with the brand of GW. So the last thing is just remember that when you're on these sites, you want to share information from credible sources. This content and these posts last forever and they're discoverable. In general, we say avoid giving medical advice. You want to save that for your actual clinical encounters. And then the flip point is that if you're actually asking physicians for advice, just consider the source and make sure you understand the risks of taking that guidance if you're going to use that on your patients. Always protect patient info, and then it's always a good idea to know your hospital and university social media policies that can help you stay out of trouble. And then I think in general, you can stay out of trouble if you're just kind on these platforms. So hopefully this was just a quick way to show you that you can use these platforms for these things. I'm much more active and visible on Twitter, so feel free, if you want to talk about YouTube or Facebook, feel free to reach out to me personally, or also manage these other accounts, and I'd be happy to answer any other questions. Thank you so much.